Namaste, Joe from Return to the Self, and I'd like to talk today about the birth topic of induction of labour. So, when I was studying prenatal yoga teacher training for the first time, I kind of realised that induction is one of the biggest problems women are going to face in the medicalised birth environment. So, basically, these days, doctors kind of come up with like 101 reasons why you have to be induced. So the first classic one is this kind of due date thing. So we will have this date which is given to us after, we have our ultrasound screening, and that's the supposed birth date of our baby. And if our baby doesn't actually come on that day, it creates this like enormous anxiety on the part of the woman and or their family, and then there's this kind of irritating few weeks of people asking you what's going on and is the baby here yet and blah 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 blah. And so riding the waves of the due date is kind of a nightmare for most women. So some of the conscious community women I know just basically refuse to even talk about this thing, due date. Oftentimes, women don't know when they've conceived, and, it's, the measurements on ultrasound and so on are partly a guess. But, really there's a kind of a window of, it's enormous, the window of when a baby actually feels like coming into the world is like 4, 5, 6 weeks open, and in the normal range. Who's to say what is normal? I guess the ultimate kind of like hippie way to think about it, astrological, is that baby kind of wants to come when it's ready, come when it's like the stars are aligned for him or her to enter planet Earth. And who are we to like push them into the world? And what does it actually do to our adult childhood psychology if we're literally ejected from the safety and comfort of our mother's womb? So says a lot. So, I've heard women who are over 40, oh my God, over 40, who, have been told they have to have an induction on the day after the due date because they are 40 and that is just how it has to be. Bollocks. Sorry, doctors, but, it's kind of all the fitting women and babies into this kind of box and having all these decisions that are made on kind of measurements and, ages. It's a little bit bollocks, if you ask me. And it's difficult. And one of the main things about inductions, typically inductions these days, they start with pessaries. So they'll give you a vaginal pessary that sometimes they're not expecting to work initially, and then 12 hours later they'll top it up, and then kind of they'll introduce synthetic hormones on an IV drip after the pessaries, so they'll start kicking in the Pitocin and all these other synthetic chemicals to induce the labour. And that kind of puts the body into like massive fight or flight mode. So the terminology is a cascade of medical interventions. So basically, once you have the pessary, you have the Pitocin drip, you kind of end up in an emergency C-section like 24 hours later, and that's just because the body just can't cope. And it becomes an emergency. It becomes a medical emergency. So what originally was designed to kind of help the woman and make sure the baby's safe and all that kind of stuff ends up in a medical massive chain of medical interventions, which obviously gives away all the women's autonomy and sends them into this massive stress scenario. So, I mean, let me say that, to be honest, not every medical induction is just, policy or doctors just fitting into rules. So there are plenty of inductions which are medically valid and, makes a lot of sense. So there are actually, one of the reasons I'm saying this is because I actually did have a medical induction. So both of my pregnancies have really have seen me having this lovely condition called obstetric cholestatis. So cholestatis is a liver bile condition which basically sends your liver bile on this kind of journey around your whole body, raising bile acids everywhere, and the symptom is this like mad itching, and it's absolutely horrific. So it's in your palms and in the soles of your feet, and literally sends you, if you had that type of itching for any longer than like 6 months, you'd probably just end your life. It's that bad. So with my son Caesar, I had, I don't know, it probably started around week 32, just a guess, but I didn't have a clue what it was, so obviously it took me a few weeks to get down the doctors, and then because it was really specific on my hands and other parts of the body too, but that is just like, pretty much, as soon as your hands and your soles of your feet start that type of itching, you just know you've got that condition. It's not itching on your belly and general kind of itching. It's like, that it's really, really intense. So my first doctor was like, oh, well, I'm not into inductions, and there is a risk in obstetric cholestatis, but, there's not much research, and I don't do inductions for that. So, it's really normal in, for example, the UK. Every single woman with that condition in the UK is induced. Every single one. It's that. Doctors don't have a choice. So that's that. And so basically Caesar actually came the day after his due date, so all was well. I was 38, that was okay, still in my 30s. So and I had a 8-hour the labour started around 9 o'clock at night, was kind of kicking in, and then he was born at around 3 a.m. So it's, for a first-time mother, that was kind of amazing. Thank you, Caesar. And so with Ananda, obviously I was completely insane to have a second pregnancy after that experience. But as soon as I started itching, I just ran to the doctor, and I did take drugs for that condition with Caesar, but they didn't stop the itching. I took them again with Ananda, and maybe because I went really, really quickly, like the moment I knew I was down the doctor, I got the drugs, and actually they stopped the itching. So thank you, medical profession. But my doctor, who is amazing, a doctor called Dr. Alexandra Shapova in Dubai, she had seen a woman and a baby who'd really ended up suffering badly with that condition. So she was like, I'm sorry, it's induction. Fair enough, there are things you can do to navigate an induction. So firstly, they'll probably try and get you in at 37 weeks. So I kind of said no to that. And I just pushed it back a little bit. So a little bit of negotiation is good. And also, the very, very important thing that you need to do is get acupuncture. So acupuncture can target the cervix, so that incredible muscle which is effaced and dilated in the later stages of pregnancy. So the effacement starts as you get up to your quote-unquote due date, and the dilation actually starts before you're in any major discomfort in labour. I was wandering around the supermarket dilated with with Caesar, 1 centimetre or something like that. So, it kind of starts. So acupuncture with somebody like Marcin Nates, if you happen to be in Dubai, amazing therapist. I'm sure there are other therapists around the world who they'll do cervix opening treatments, and I swear that it helped me. Also, I was really lucky to speak to someone who had a successful induction. So to me, a successful induction is one that doesn't end in this, in this medical intervention cascade. So that, I was absolutely scared to death of having a C-section, especially an emergency C-section. My husband generally works every hour of the day, and God only knows how I would have coped if I had had surgery. So, plus 101 reasons why you don't want a C-section, including long-term pain, including, the baby not having the opportunity to develop an immune system, just a few important things like that. So personally, I wasn't, I was just really scared. So I had lots of acupuncture done, and the doctor did a treatment to kind of help with the baby's lungs, so the baby was kind of cared for. You kind of have to think, well, need to help them because they're not coming when they want to. And yeah, so what happened with me? So I had already experienced a labour, so that kind of gave me an idea. That helped a lot. And I went in at 12 o'clock and had a pessary, and nothing really happened. And then the next day, I had a second pessary, like in the morning at 8 o'clock. And my doctor said, "Oh, and when you think you're about 2 hours away from giving birth, just give me a ring. I'm off to my clinic." Funny lady. She trusts me a lot. So I was like, okay. Yeah, and then I actually kind of felt like it was like a bit of a drug experience. So you kind of come up on this induction drugs, and I was like, oh my God, yeah. The labour like kicked in like big time, and it just went from zero to hero. And then the birth was kind of a tapas experience. So I've done a lot of Ashtanga Vinyasa yoga, where tapas is kind of fortitude, or like breathe through the intensity thing, is a major feature. And anyone who's kind of, all those people doing Supta Kumasana and, all of the crazy back bends and all of that stuff, you kind of need to get your head around like doing extreme physical stuff. And basically that became my support system for getting through this induction. So child labour with Ananda was basically about how much pain can I tolerate. And that was my thing. So, yeah, I totally made it through. So, I was okay. I'd learned, obviously, breathing techniques like the golden breath technique are really good for, mild labour as it builds up. But once you get to that, the rhythm of induction, which is just absolutely mad, it's so excruciating. You have no, forget all that. You basically either operate on your ultimate primal instincts, or you probably will end up in this medical chain of interventions. So it's kind of like the way to get through an induction is like crawling on the floor. Let's wait for the van coming by my house. So yeah, this is like induction 101 if you want to make it through. Crawling around the floor, rolling out around the floor, howling, groaning, releasing the most primal kind of groaning, and it's it was giving me a sore throat. How I got through that, but yeah, that's what you have to do. That is, if you have any kind of idea of embarrassment or like trying to look good during labor, it's not going to work, especially in induction. So it's tapping into that monkey mind, and honestly, with a regular labor, it's the same thing. Your body will basically tell you, it's too much, I can't take it anymore. And if you watch one being born every minute, you'll see most women come into transition, which is where the shit hits the fan, and you're like, and the women will say, I can't do it, or I can't do it, and it's something like that. You can like literally clock their transition. So anyway, so once I had got into a really intense stage of labour, I was like, wow, like call the doctor, like, this is it. So because I'd felt it before, and I was like, yeah, this is super, super intense. So I called her, and she came, and she basically told me, oh, look, like you're like 4 centimeters, and what, she was kind of annoyed, and I was like, no, seriously, like this is kind of bad, or I probably couldn't talk at the time, but I was like, no, like I'm right and you're wrong. And yeah, she was like, and I apparently what happened to me is I went from 4 centimeters to 10 centimeters in, I think it was 45 minutes. And this, I'm not lying, that is not what's supposed to happen in the medical textbooks. The woman knows best. The woman knows best. You don't know how long it's going to take. Don't listen to numbers in labour. Just don't listen. Doesn't mean really. Just forget it. They tell you any number. I don't care. I was like, before the labour, I was like, I don't care about these numbers. You can tell me I'm 1 centimetre. I can feel what's going on. You can feel your cervix opening. It actually, to be honest, in induction, it hurts because it's, medically induced. So, yeah. So anyway, I went into the birthing pool in Al Zahra Hospital, and because I didn't really know what I was going to do with that level of pain and intensity. It was just like, it was just like, there's no doubt that very few people can honestly say that they can handle that level of pain. It's like serious stuff, and you basically have to really, if you want to put anything into your head intellectually, it's like, I'm not going to die. Just one breath at a time, and how like crazy. Everything went well. So I'd had a medical induction, these couple of pessaries, but everything went well. Ananda wanted to come in the bath. And that's another story, but, we called the doctor, the doctor was in her coat and about to go out, according to my husband, Emmy. So she had no faith that I was going to, go from 4 centimetres to 10 centimetres in that time. She was just like, she's, forget it. So she came in the room and going, apparently, like, I don't think it's time yet, is it? And the midwife was like, yes, the head, blatantly, there was Ananda's head was in my pelvis, as I could feel. And, but she was, she was born naturally, everything was good. Sadly not in the bath due to Caesar's history of placenta. That's another story. But, hospital birth, actually many women are required to have a hospital birth. And although I'm really into this idea of women having this beautiful home birth environment, actually, coming from someone who's had 2 hospital births, honestly, it's not about where you are as much as who you're with and how you feel about it. And, you can be in a hospital and you can have an empowered birth. You can have a C-section and have an empowered birth if you're able to take measures and steps to make it more woman-centered. You can have an induction and have an empowered birth, but you have to do a little bit of preparation, and, you know, talk to women who've had successful inductions. You know, I don't want to create fear around induction by saying it kind of hurts, but and actually, you know, honestly, my real dream, if I had another pregnancy, would be to you know, get into that paradigm of pleasure and, like, you know, look at how I could make that mental shift into having a birth that was not only woman-centered, empowered, but was also ecstatic and orgasmic, in the sense that, you know, I wasn't expecting pain, and the pain wasn't like the thing, you know. And some women who do a lot of hypnobirthing, and you know, it's a really amazing technique to get into positive psychology. But I know some women who've, like, said to me, well, when I got into the real situation, the shit honestly hit the fan. I did no idea of what was going to come, and I was a bit disappointed that we just chucked it all out the window. But, you know, so I don't think, you know, I think if you're talking about something like induction, you can't then just avoid the word pain, because you might have to navigate intensity. But honestly, and that's where yoga has really helped me, yoga gave me a portal into navigating that intensity, as did this deep knowing that I could access my primal inner nature and just crawl around the floor screaming. Not screaming, howling. Like I don't know. It's hard to recreate. But, you know, one of the things I do in my pregnancy yoga classes, I do little bits, and especially in private support for women, I do little bits of animalistic expression. So voicing intensity. Anything that cuts the barrier of embarrassment, holding back, and anything to tap into your primal nature as a preparation is beautiful. And I recently went to a workshop on presented by a woman who focused on the goddess of the Egyptian goddess, forgotten her name, but, you know, it's really super intense. You're like, that one. You will put the name into, you'll get it if you know this divine feminine work. But, you know, she is like the inner kind of tiger, and this is birth. This is just basically accessing that inner fierce goddess. So, you know, you can do it. A birth is not supposed to be like Lakshmi and beautiful, but it can be sexual, can be kamalatmika, you know, the deep sexual energy of woman. But with a medicalized labour, it's a bit more like Kali, and her. I have to just tap it out because it's really annoying me now. I've forgotten her name. Egyptian Kali. So it's not coming up. Yeah. Anyway. So, induction of labour. Send me your messages about induction of labour. Hopefully no medical complaints from doctors. But, you know, there's a lot of value to listening to your inner wisdom if a doctor is pushing you into an unnecessary induction. And try changing doctors. Not everybody's opinion is valid, honestly. And yeah, so I mean, try to avoid having an induction if you don't really need it. And if you do need it, you need to prepare. And if I was you, I'd get some support in that preparation, because, you know, coming out of an induction with a good, it's harder to come out of an induction with a good result, but it's totally possible. So if that's you, please get in touch with me, and I'm happy to work with you online. And sending you lots of love from Bali. Joe from Return to the South. Namaste. Jai Ma.